So it is my pleasure to talk to you today about, along with Professor Solomon, I get to share my presentation with her, which is a great privilege, Instructing the Young Dancer for Pointe Work, Minimizing Risk, Maximizing Readiness. And I got too many computers up here, I'm going to get confused. So in 1832, Marie Taglioni was the first dancer to perform on pointe, and this was in a performance at the Paris Opera Ballet in the piece of La Sylphide, which her father created just for her. So that's pretty cool. And still today, dancers strive to create that ethereal sylph appearance and role when they dance on pointe, but dancers in the 21st century certainly face their own unique challenges. It's quite different now, of course. And one of those, as we've talked about already, is injury prevention, or what do you do when you get injured? So that's what we're going to focus on today. And as Dr. McKaylee and Dr. Quinn have alluded, there's many factors that go into injury and injury prevention. I want to focus on some that I think are most pertinent to pointe work, and Ruth will carry that forth in the second half of this. But functional anatomy, Dr. Quinn very nicely described the anatomy, and I'm going to talk a little bit more about how it all works together as a whole at the foot and ankle. Again, not to insult anyone who this is old hat to, but we want to make sure that we're all thinking in the same way. And sometimes even when you know stuff, when you sort of think about it in a different pattern, it is helpful. So functional anatomy, of course, is what the body's anatomy can do to create a movement or function in the body. And for the dancer specifically, that's a movement pattern. Biomechanics is basically the physics of movement as applied to whatever sport or activity. And for the dancer particularly, and for a lot of other sports in general, I think technique really is almost equivalent to biomechanics. If your technique or biomechanics aren't correct, you can be in trouble. And then, of course, recovery, which is appropriately managing your training so that the tissues have a chance to heal and reset to prepare for that next performance or class. So if we look at functional anatomy, Dr. Quinn has already talked about the movement of the ankle, and dorsal and plantar flexion is certainly important, and that occurs up here at the talocrural joint. And in that position, you can see how the talus here kind of sits on the back of the calcaneus. And that's actually a pretty stable, bony position. Jeff Russell and colleagues looked at the range of motion in dancers. They did some x-ray analysis of several dancers and determined that this talocrural joint could contribute up to 57.6 degrees plus or minus 5.2 rather, of dorsiplantar flexion. The rest of it came from motion in the midfoot here. You've also got the subtalar joint, which this illustrates the inversion-eversion motion. So there's actually two joints at work, even when you're talking about just pointing the foot, or actually probably more than two joints. So I'm going to try to do this and maybe just put the laptop up so you guys can see, because this is a pretty cool video. Dr. Nancy Cadle, who is a foot and ankle surgeon in dance medicine. I'm really going to challenge myself here. Whoops. And she has put together a video of a cadaver which illustrates the motion of the foot and ankle during pointe and demi-pointe positions. I don't know if you all can see that, but basically it just illustrates the motion in plantar flexion and back up through demi-pointe. But if you can see that, and I'm happy to show this to anybody, or you can Google it on YouTube. It's a YouTube video, which is part of the problem since I have Microsoft. And there's a slight bit of inversion as the foot gets into the full point position, which helps lock that in. So it provides some additional bony stability. So the other structures, of course, the bones provide some of that static stability, but as Dr. Quinn has described already, the ligaments are an important static stabilizer. You've also got the muscles, which provide motion as well as stabilization for the movement of the foot and ankle. And you have the gastrocsoleus for plantar flexion, the perineals for eversion, lateral stabilizers. The FHL for the dancer's tendonitis, which flexes the great toe, also serves as in function of pushing off for jumps, as well as support of that medial arch to give that nice arched foot appearance. And then, of course, it's often injured, so it has coined the name of dancer's tendonitis. Posterior tibialis, TOM, is for plantar flexion as well as inversion. Anterior tibialis for dorsiflexion, and we can't forget the foot intrinsics. And this is just a diagram of, from each angle, the multiple muscles that are involved. And you can see that there's a lot going on there. I mean, I listed just a handful, but there's many more that provide function, and not just the movement portion, but also the stabilization portion, because the bones can't do it on their own. They can do it with the help of the ligaments, but you need that strength in those muscles. And as Dr. Quinn pointed out, you need those foot intrinsics to help hold that foot in the proper position. And I think you can imagine, if we go back to the ligaments here, if these in the hypermobile dancer, which is a common problem that we all see, yes, that if these are looser, there's going to be more movement within those joints in the foot. Now, the dancers and the teachers and the artistic directors are like, yay, this is great, huge aesthetic advantage. But what's left then for the stabilization? Pretty much just the muscles. And unfortunately, those hypermobile dancers aren't always the ones that are working hard to strengthen, to provide that stability, often until they get to the point of an injury. So being on point requires motion into the plantar flexion. You need muscles to strengthen, to move it, as well as to provide stability as you're in that point position, as well as to stabilize and balance. So they're always working constantly to maintain that position. And I think it's pretty easy to imagine that if those structures, all of them aren't doing their job, then something's going to have to make up for that, and that's often when an injury develops. So as Dr. Quinn has already pointed out, we're talking about the ankle and foot today, but it's not the whole story. It doesn't work in isolation. You've got to look north or above, and Ruth is going to talk more about that in detail. If you're not lined up everywhere else, it's almost impossible to stay lined up at the foot. So this little nugget comes in, and when can I dance on point? Good question. We look at point shoes. We often think in biomechanics, when they're studied and analyzing, as Dr. McKaylee alluded to, how does the running shoe help the runner? I don't think anybody's really been looking at the point shoe. Certainly it's quite different today than when Marie Taglioni was first starting. However, I don't know that there's been much change probably in the last 100 years or so. So if we kind of dissect, if you will, the point shoe, and I did my own dissection in my garage. Fortunately, I didn't lose any appendages. We look at the anatomy of the point shoe, and of course the focus is on the box here, which provides support for the toes and the metatarsal phalangeal joints. You've got the vamp that comes up and the wings around the side that helps support the sides of the foot a little bit further up towards the mid-metatarsal region. And that is often what the dancer is looking for in terms of the aesthetic look in the shoe, but comfort and fit is critical. This has got to fit snugly, not too tight, not too loose. The shank, which comes in all shapes and sizes, we could have a whole day discussion on which one's the best, and then it's got to fit at the heel. So as lovely as the foot looks in these, especially if you've got them all bejeweled like that, I can't imagine what those cost. I know what the regular shoe costs. Does it help? Is this just an aesthetic thing, or is there really some support? So Dr. Cadle, who is responsible for the video, did some analysis with cadaver feet. She took a bunch of cadaver feet, jammed them into point shoes, and loaded them, and determined that that it does provide support. And she did that by sequentially cutting, all those ligaments that Dr. Quinn showed you. Cut one, cut another, and each time put it back into the point shoe, and found that even when the foot was completely unstable out of the shoe, that the shoe was able to provide some semblance of alignment. So it does work. How well, and does it prevent injury? Probably not. In 1998, Cunningham and colleagues did a mechanical analysis on 5 different brands of shoes. And they basically took these and, like Dr. Michaela described, banged it, did compressive force analysis, axial load force analysis, and determined that the shoe started to break down mechanically at about 4,300 newtons. And they did a calculation that the average ballet dancer would provide a load with full weight on Pointe at about 4,950 newtons. So they concluded that there must be a symbiotic relationship, if you will, that the foot support uses the shoe and the shoe uses the foot support to provide that support, that strength. And they looked at these 5 different shoes, and one of them was not deemed to be stronger, better, faster, or whatever than another, and fit and comfort were the priority. And I think if you want to make sure that when your dancer is getting fitted for shoes, that someone is actually looking, how does that toe box fit? How does the vamp support? Does it come up high enough? And I don't know what's happening here, but this is not good. So you want to make sure that they're trying them, and it's not just about can they get their foot in there. So when are they really ready? Traditionally, and not to minimize this, but I think this is where it all started. Age was important. Age is considered around 12 years to be an appropriate time to start thinking about it, but we all know that all 12-year-olds are not created equal, especially with respect to musculoskeletal maturity and neuromuscular control or balance. 3 to 4 years of training was considered optimal, but as Dr. Michaeli has pointed out, not all dance training is equivalent, and that other teacher is out there. So you have to make sure that that training was adequate to provide the necessary skills. And of course, ankle range of motion. So no disrespect to ballet tradition, I think that we have to look at some other things as well. I think alignment and placement with movement is important. It's one thing to be able to stand there, it's another thing to be able to maintain it when you're moving. Lower extremity strength, of course, is important. From all the anatomic structures we see, we understand that. Neuromuscular control, balance. Past and current injuries, what's that dancer been going through? Are they ready? Even if their strength and everything else ready, is an injury something that should be considered before you start them? And in 2004, MEC surveyed a bunch of dance schools through the country, and 75% of the institutions used components of age, years of dance experience, present and past injuries, releve alignment and stability, tendu foot position, and upper body stability and alignment as measures to consider whether the dancer was prepared for pointe work. In 2010, Megan Richardson at the Harkness Institute looked at more functional tests for trunk control and dynamic lower extremity alignment to correlate with teacher evaluations. And they found from several tests that these 3 represented the closest relationship and matching to what the dance teachers looked at. In the airplane test, which is pictured there on the left, and the dancer basically in an arabesque position then has to plie on this standing leg and maintain the arabesque position. An en dehors pirouette, and with good stability and position in both the preparation, turn, and landing. And then sauté test, which was 32 sautés double leg or 16 single leg, was felt to be representative of enough strength to do this. So technique, I think I will pass on to my esteemed professor of dance, Ruth, but I can't emphasize enough the importance of technique. I think the physics is one thing, the quantitative, but the technique is really the qualitative, and that's where you as the dance teacher, as the physical therapist, can look, and myself and the rest of us in clinic need to look at what's happening to that dancer that potentially could create a problem, even if they don't have an injury right now. I'm pleased to pass this on to my friend and colleague, Ruth Solomon.
Okay, not to make a big deal of this, all right, preparation. I don't like to stand behind the lectern, and yet I may have to, if you want to hear me. When I move, I'll ask you to click. Yes, I will project. Thank you. I want to talk a little bit about the fact that we've been doing this for a very long time. We've been looking at readiness for point work. This study was done in 1993. Dr. McKaylee and Dr. Mary Lloyd Ireland and I did this, and we put dancers on a Cybex machine and did plantar and dorsiflexion with them on it, and we asked them to do about 10, 12 reps a foot, and it was amazing because the controls that we set up, age and non-dancer controls, came out much stronger than the dancers. And we couldn't figure out why, except that once we told the dancers that they were going to do 10 or 12, the dancers carefully went up and got stronger and stronger. The controls just powered away right from the top, and they had no worry about their ankles or feet. And so psychologically or intentionally, they controlled how much force they were going to put on that Cybex machine. So we realized that that probably wasn't a good test, and that the factors to consider were chronologic age, growth plates, bone density, and strength and endurance. And as I said, the dancers all demonstrate greater range, but the controls generated much more peak torque. And we figured out from that study and wrote it up that dorsal and plantar flexion strength are really less accurate indicators than other factors. And the risk factors to consider in this were alignment of the tibia over the talus, which you've heard about. I'll talk a little bit about that. Intrinsic foot muscles. That was really the key in our assessment. And the everters and inverters, as far as strength and endurance were concerned. The alignment of the leg, not just the alignment of the tibia over the talus, but the alignment of the whole leg, so that when you're considering genuvalgum here, which is not these, the genuvarum. Oh, sorry. Oh, I wanted to go back. One. Yeah, can I go back? I clicked too fast. But anyway, it was. Okay. Yeah, thank you. And the tibial torsion. And that was really one of the things that was key as to these leg alignments may not be optimal for point work. Now, if the dancer is young enough, I believe very, very strongly that a lot of this alignment can be worked on in technique class, and that if the dancer is young enough, those bones can be remodeled to a certain extent. They are not fixed, hard, dead things, okay? And even tibial torsion, we can work on a little bit to some extent. And it is up to the dance teacher. How many dance teachers are in the room? Oh, bravo. Oh, God. You are the key to everything. Believe me, you are the baseline, and it's with you that this all can change. Okay, you are the preventers. The result of this research, as I said, didn't bear out our initial hypothesis, but it demonstrated a need to focus elsewhere. So I'm going to talk about, just for a moment, about another study that was just published in JDM&S. I'm the editor-in-chief of JDM&S. This is not a plug, but you might look at it. Okay. Anyway, when can I start point work? and the guidelines for initiating point work. And this was published in 2009 by Dr. David Weiss as the author. And he was a great supporter of Sparger, Celia Sparger, who wrote a book in 1970. So this has been thought about for a long time. And different foot types, which she indicated in her book, and this is a photo, comes right from the book, demonstrates the different foot types. You really look at them. And one of the interesting things in the slide that Dr. Geminiani showed you was that dancer on Pointe, where the arch was very low in the foot. And that really will cause a problem if the break is in the metatarsal rather than a little further up and the strength goes up into the foot. And this strongly knit foot, even though it doesn't look as pretty as the high arch foot, might in the long run be a better foot for point work. Sparger had a really nice quote, and I just want to read this quote because this is from 1970, and she was a teacher of dance, of all things. Okay, point work is the end result of slow, gradual training of the whole body, back, hips, thighs, legs, feet, coordination of movement, perfect balance, with a perfect demi-point, oh my God, and without any tendency to sickle in or out, or the toes to curl or clutch, and I'm going to talk about that in a few minutes. This moment may arrive at different times in different children by virtue of their physical type and previous training. So there's nothing about chronologic age that determines readiness for point work. And from David Weiss's article, growth and development need to be considered. Teachers should perform their own assessment to ascertain whether the student has proper control, good abdominal strength, and I mean psoas. Okay? Anybody who's ever heard me talk knows that I talk about the psoas. I'm not going to stress that here because this is a foot and ankle talk, but if you don't really have the psoas working for you, it's going to reflect down into the foot and ankle. And sufficient lower leg strength and appropriate hip-knee foot alignment. Okay. This is my slide, not from David Weiss, but if you don't communicate with the parents, you're in big trouble because it's the parents who come in and say, when can my dance on Pointe? The kid, of course, wants to, but you get pushed by the parents. And so you need to communicate exactly where and how you feel that child is in their development to go on Pointe. You may not be able to predict how long it will be, but it has to do with communication. Okay, I want to now talk a little bit about the biomechanics. And as I said, it all begins with the whole foot on the floor, and then moving into demi-point, and then on to point. And if this is trained incorrectly at the beginning stages, it will affect all succeeding stages. Now I want you to look at this. I'm going to keep a secret whose feet these are. But here I've contracted the anterior tibialis tendon, okay? And you can see it. And you can see the range of the demi-point. And this is as far as I can get with that tendon contracted. Here, that tendon is released, and you can see the deeper flexion. So that when you're going into demi-plie, that tendon absolutely has to be released, in my opinion. And these are all, please, no, they're my opinion, okay? I have to emphasize that. So these are the risk factors that we've talked about, and poor tissue quality or previous injury is indeed one of the risk factors. If a dancer or one of your students has had a previous injury, they are predisposed to a second or third. Okay, and, oh, I did it again, I flashed too fast. Thank you. Here is my foot on point, and I'm trying to align the tibia and the talus, but I'm way behind the plumb line as it should exist. And here I'm doing a little better. I'm still not coming directly through, and as Andrea so subtly pointed out to me, that there's a little arthritis in this foot, but just ignore that. Okay? Jeez, Andrea.
She's not even in the room.
Okay, yeah. And here, I just wanted to show you the same kind of mechanism in a point shoe. Now, neither of these is functional. You can see that here is the tibia, and you can see that the talus is way forward of where that on-point dancer should be. And I just want to emphasize that almost every dancer and every young dancer and every teacher probably at some point falls under the spell of a dance magazine. This ain't research, okay? Dance magazine is not research. And they have photo after photo of this kind of a foot, and in point shoes in their ads as ideal. It is not ideal. So tell your young dancers that this probably comes from a hyperextension in the knee so that they can force that talus forward, and it's Dance Magazine is not the ideal model for dancers. These are the different risk factors in the foot that I started with. Foot type, poor biomechanics, pronation, compensation up into the pelvis, and malalignment of the metatarsal and first MTP joints. I'm not going to talk about this very much because Bridget already did, but I just wanted to show you, because we are talking about point, that here's the fiber osseous tunnel that FHL goes through. And this is a nice picture from Grant's Anatomy where you can actually see that. And when you're going up and down on releve and onto point, that FHL has to move really smoothly and glide through that tunnel. And if it gets irritated, it gets stuck and triggers, and you will feel that triggering, and the dancer will tell you, it feels like as you're going up or down, and there can be swelling really right through that, and then the young dancer or the professional really has a harder time. I wanted to show you this particular study which also happens to be coming out in the Journal of Dance Medicine and Science tomorrow, okay? And I think it's an excellent look at the dancer's foot in hallux valgus. And it really analyzes the hallux valgus. And here, the reason I'm emphasizing this particular study is because it has beautiful figures in the text, and it shows the motional, the cardinal motions of the first MTP, and here first and second intermetatarsal angle of 18 degrees is diagnostic of hallux valgus, okay? And here is a wonderful drawing of how the tendons, okay? And once the anatomy of the forefoot gets into this state, or even mildly into that state, there are tremendous forces that then exacerbate the deformity. So that's why we can't have this start. We have to catch it before it ever gets to this stage, because it then becomes very, very difficult to correct. Okay, here is an X-ray also from that study where you can see what's happening with the bones. And this shows you the rotation of the standing leg with even weight distribution over the foot, which is important. And then you start to see this rotation, okay? And you start to see this angle when they are forcing turnout. Okay, one note which I think Bridget or Dr. McKaylee mentioned, there's asymmetry throughout the body. And you can see a dancer standing first, and it might look all right, but there is quite a bit of asymmetry. So what do you do about this as a teacher? You don't make the dancer turn this leg out more, but you have to allow them to bring this in to match the leg that does not have the external rotation. Oh, I want to show you this. It's from the cover of a program of the San Francisco Ballet, and look at this. Is that stunning? I mean, every one of them, every one of these swans. All right, this is the highest level professional company, and don't you think we see injuries in that company? Mm-hmm. All right, look at this, one after another. And it was on the cover of the program. Okay. All right, we did this study in 1985. It shows you I'm getting older and older. But it was a study I'm not going to mention much about, but it is the list rank. The reason I bring it up is because it shows you that there is a stress fracture right at the proximal end of the second metatarsal. And Dr. Quinn mentioned the stress fracture in the second metatarsal, here in the second metatarsal bone. But we did this big study because this fracture can go on to non-union. It is an almost impossible fracture to heal. And the mechanism is when you're on point, that second met is really up into that joint. And then you start to torque on a pirouette or anything. Can you imagine what I'm talking about? so that once you start to turn and you're on point with the head of that second met really jammed up into that joint, which is what happens naturally from that. The stress on this part of the foot is really quite vulnerable, okay? It makes the foot quite vulnerable. Okay, I'm gonna go up. I can't imagine whose foot that is either. Now, I put it by the wall.
Okay.
So if I fall over, I just fall into the earth. All right. Yes, thanks. Oh, okay, you're going to change the slide when it comes to that.
Change the slide.
They're all worried about, oh, that's perfect.
Yeah.
Okay, they're all worried that I'm going to fall off this table.
There's PTs in the audience. There's doctors and PTs in the audience.
Yeah.
Chiropractors,
Yeah.
acupuncture, we've got you
Yeah, we
covered.
will, but rather not. Just saying.
Yeah, it's nice and stable.
Okay.
I think I'll demonstrate this on my knees. Anyway, I wanted to show you that anterior tib contraction because it's much better looking at it in reality. Okay? Look at that. Okay?
Yes.
And stand up or get where you can see, especially since I'm up here. I mean, I tried to get off the floor. If I'm up here, you're up. One of the Boston Ballet dancers came into the clinic to see Dr. McHaley. And sure enough, she had 180 degrees. She was really like this. And she said, oh, my coach, not one of the teachers, but she said, oh, my coach said I have to lift my ankles, lift my arch, so that I'm not pronating anymore in first. So ignore the fact that I'm not in a good first. But she's trying to lift her ankles, which of course made her grip the toes and contract the anterior of the tibia. And as you can see, this really inhibits the ability to go into demi. Now I'll release that. I'm going to release the toes, and I can do a demi with the pelvis centered. Even if my pelvis is centered and I'm doing that, I'm still not going to be able to move. And dance is about movement, you know? And if you're like this, what happens when you try to move? You can't move at this stage. You have to let everything go to make a movement, okay? So don't tell people to lift their arches, okay? Or if you see a dancer trying to keep from pronating, try not to use that mechanism, all right? The other thing I want to, going onto demi-point, you go onto demi-point and you do that, okay? That looks pretty much like that, right? All right? Imagine this doing a pirouette because all the ligaments are off, but are being distended this way. So you're going into a pirouette, which means that the work can't be only on the first and second metatarsal. That it has to be at least spread across, and the toes have to be free enough. Okay, see, I'm trying to wiggle them, so that those ligaments across the joint are not being torqued. So if you're on the first and second only, here like this, not only that, it hurts.
Not to mention what it's doing to your sesamoids.
All right? Okay. Okay. The other thing I want to mention is, of course, I mentioned curling of the toes, and you'll see your young dancers in ballet shoes, and all the little knuckles come up, and you can see them curling the toes in the ballet shoes. And in modern dance, it's much easier. I wouldn't let them do this because I could see it. But in ballet shoes, it tends to hide. And certainly in pointe shoes, it tends to hide. So what you don't want to do up here is really watch them try to hold on to the floor with the toes. All right? You can see this? It's not a good idea, okay? Oh, and the one other point is to not lock out the foot in demi-pointe releve. Here I am about where I can work. This is about where I can work. If I go here, this is not usable. Okay, I have no strength and I've lost the pelvis. My strength is somewhere in here where I can control the going down and control the going up. Okay? Does that make sense? Yeah. Okay? So if you see a dancer lock out here, you know they're not using the pelvis and they're not in a functional, motional state. Okay. Winging, you all know about winging and winging the foot, and that's not usable. A lot of styles require winging if there's no weight on it, and that's okay. You can wing it if there's no weight on the leg and choose your arabesque. Okay, and this is an attempt of mine to work, and this is a number of years ago. This wasn't when the foot looked like this, but this is almost like that. And here, I'm trying to get the foot aligned, and because of the deformity already created in the foot, there's almost no way I can get all those toes where they're supposed to be anymore. So if my ballet teacher, Mikhail Mortkin, who danced with Pavlova when I was 7 and taught me, had picked this up and not demanded and come and beat me on the calves with his wooden stick every day. Your feet are not tight enough and you're not turned out enough. Maybe. Can I blame the other teacher? You bet. Okay. So it's important from early on. Good. Okay. Now we can play. Before we play it, I have to tell you. This is, I know we're talking about pointe work, and he didn't do pointe work. This is Rudolph Nerea. He didn't do pointe work, and you're not going to hear him speak because somehow we can't get the audio on this. But just look at his feet. And he starts off, the first thing he says is, dance is effort. Effort. Okay? So just imagine the rest of his conversation. Watch his feet. This is in his studio just after he retired. Now, wait. This is total 1 minute. There you go. Can you see this?
Oh, yeah.
Wait, there's one. Good shot. Look at that. Look at that. Okay, it's good he never had to do pointe work, because that would have really been hard to get to flex. And you can be a gorgeous dancer and beautiful, and anyway, that's what his feet look like at this point in his career. So, and he's speaking about how much he loves to dance, and he has to do the bar every day of his life. Okay, there we go.